So as people are going to be joining in, I did see a lot of people signed up to this class who live out of country. And those of you who may not be familiar with us and who we are and what we do, we're going to go briefly into this presentation, but also we do have all the information available to you on our Facebook page or the website. So you can always reach out to us. Our email is very simple. It's victoriaandoksana@gmail.com, but we also have a domain email, which is hello@victoriaandoksana.com. So let me just wait a few minutes before we get started. Let me know that you can hear me well. And we do have a free Facebook group, and you can easily find it. If you search on Facebook, you'll find a Facebook group where we have that replay available, as well as everyone who signed up to this class, the replay will be emailed to you. So I believe that everyone is muted, so that way we don't have background noise, but you're welcome to unmute yourself if you have any questions, or you could put your questions in the chat box as well. Okay, another thing I wanted to remind is we started doing these classes about once a month for people in a mailing list. So if you feel like you're benefiting from it, let us know, as well as what time would work best for you. We did have about 100 people that signed up for this class. However, I do know that others were in a different time zone, so there's always some kind of confusion joining the meeting or the time confusion, because you do have to convert it to Eastern time zone, as well as we do work with people internationally. So I did see a lot of people from different countries sign up to this class as well that might not be able to make it. So I do want to hear from you, those of you who are on this class, or if you're watching the replay in the chat box, you can let us know what time works best for you, as well as where you're tuning in from, what questions you have for me. So you're welcome to ask any questions. And otherwise, we're going to start with the presentation in just a minute. And I do like to remove my video so we can focus on the slides. But like I said, this class is for you. So I do want to know what are the questions you have for us. What is it you're struggling with? But I do want to give you a lot of clarity in terms of chronic effects of inflammation and what might be triggering that, as well as what needs to be done to repair the inflammation and how we are doing that for clients globally within 30 days where they are reversing these symptoms. So let me just stop my video, and I'm sharing my slides so we can focus on the slide. So if you do enjoy this presentation at the end of this class, at some point today or tomorrow, you can go into in a Facebook group. We do have a public Facebook group that you can join, where you can simply go to your Facebook profile and take 1 minute and tag us. So you can tag us on Facebook, Instagram, YouTube, Victoria Oksana, and you can write down one takeaway that you learned from this class. So as you have probably seen in an email, that everybody who signs up to a class, we are either giving you 2 extra weeks in a program if you do decide to work with us and get help reversing your autoimmune disease. So we do give you 2 extra weeks. And we can also add on top of that a $500 discount in a program, so which can help you, again, be able to get the help that you need to reverse your autoimmune disease. So we are offering it to everyone who's on this class if you do decide to get a help, okay? And so one thing I wanted to know is, if you do enjoy this presentation, go to your Facebook profile, tag us and let us know. And as well as you can write down the takeaway, what you have learned from this class. I can help you with one takeaway, just give it to you right away. That did you know that genetics, it accounts for only 3% of all chronic diseases? So people always talk about how genes trigger your diseases, right? Your genetics plays a role in disease activation, but it only accounts for 3% of all diseases. Everything else, we're going to talk about what else is causing those diseases. And like I said, feel free to put your questions. I will address them. I'm either going to pause in the middle of the presentation, or I will answer your questions at the end. And it's going to be about a 30-minute class, so I don't want to take too much time. Do it. So let's get into the presentation. So what we do, again, it's evidence-based, which means it's scientifically proven or shown in the clinical literature worldwide. And we help people improve their health outcome rather than being stuck with the disease forever. So everything we recommend is also based on our results and experience reversing diseases, symptoms, and autoimmune markers within 40 days. In fact, we have had clients who became symptom-free in that time frame. So again, it is science-based and it's results-based as well. And we are sharing our client results every day on a Facebook page. So you can see that we're not just trying to help people, we're actually helping them. But a little bit background about us. We were born in Ukraine, and this is a picture of my sister and I. Her mom used to dress up the same, but then as we got older, she started giving us different clothes, and we did have different colored ribbons and different clothes, so she can tell us apart. So this is me on the left. I'm on the left here as well, and this is my sister Victoria. We are twins, and we did grow up in Ukraine, but we did suffer with different issues, ear infections, thyroid issues, just not going too much into detail about that. But at 12 years old, we came to the United States, and we ate standard American diet for only 10 years living in the United States. But we already were so sick, just 10 years living in the United States in a standard American diet. Of course, you know, it's GMO, it's processed foods. We started getting allergies, infections, migraines. All of that information you can find on our website. So basically only 10 years eating standard American diet, we started getting these problems. But then I did take college courses in immunology, and that's why my immunology professor was very good. She was able to explain complicated immunology presentations and help us understand the immune system in very simple terms. So that's where I fell in love with immune system, and I went to study immunology after college, and we have published dozens of research papers. So we are peer-reviewed, published immunologists, but all the research papers, they are found online. Sometimes people email me, can I read your research paper? You can just Google it and find it. But basically, we have taken a long time to understand the immune system and see how diseases happen and what we can do about them, aside from just take medications. And I do have a publication in the book chapter that I have co-authored. That's my name, Oksana V. Grusty, on HIV research. And we have studied how we can use adeno-associated viral, which is non-pathogenic, to try to interfere with the HIV infection, how it's infecting the body. But either way, so the bulk of this presentation is about chronic inflammation. What is triggering mechanism of inflammation, how we can stop the progression of diseases, and how we have done it, as well as it's really all about epigenetics. Epigenetics means, what is epigenetics? It means your lifestyle, your nutrition, and your environment. That's what ultimately triggers chronic inflammation. I'm going to go more into detail about that. So inflammation is triggering mechanism of all of these diseases that you see on the slide. This is just an example of some of these diseases, but there's so many of them. So all of these diseases, if you're not able to heal from inflammation, it means that you're still injuring your cells, you keep re-injuring your cells with inflammatory foods, even though they might be healthy foods, but they're still inflammatory at the cellular level, or you're not realizing it. I'm going to give you some examples of what those foods are, even though they may be healthy for you, but they do have an inflammatory component. So for example, many people think that honey or taking or drinking protein powders is anti-inflammatory, but these foods are inflammatory based on, again, studies and experience helping people become symptom-free rapidly. And so we do go into details about that in our client classes, but a lot of people eat this type of food. They're eating honey or they're eating protein powders. They're thinking that they're eating really healthy, but unintentionally, they are still keeping the disease alive in their body. But then the second aspect of it is, if you are not reversing inflammation, you might not be doing enough of the right things for healing to take place at a rapid rate. So that's what we're also going to talk about. So a lot of people, they do experience symptoms, and they also make a conclusion what the symptom mean. And the conclusion is often not correct. So not every food you're going to eat will give you symptom. So you could be eating certain foods, but you don't have symptoms from it. but they could be the ones that are keeping you sick. So incorrect conclusion leads to wrong problem, which leads to wrong solution and therefore the wrong results. So what we do when we work with our clients is we help you problem solve. What is that? Still keeping the inflammation levels high, but as well as guiding you through the disease reversal process. So we correct the mistake that you are making. So that's one thing I want to talk about, how when they tell you if something is anti-inflammatory, that's because they could be comparing one food to another. If you compare honey to processed sugar, of course, honey is going to be less inflammatory, but it is not anti-inflammatory. Does this make sense to you? So that's when you're trying to heal from a disease, you want to make sure everything you're doing is eating is helping you heal that inflammation. So itis, anything that you see that's labeled in itis, it means inflammation. And inflammation came from the word called fire. So basically you have a fire in the body. So inflammation is not always bad, and it controls hundreds of biological mechanisms by keeping your body in balance. However, when it's under control, inflammation, that's too much inflammation, and that's what triggers our genes for disease. So you can see all of these conditions like colitis, inflammation in the colon, arthritis, inflammation in your joints, dermatitis in the skin. All of these are inflammatory diseases. So that's how you can identify if you have an autoimmune disease. But let's talk about briefly the difference between acute versus chronic inflammation. So acute inflammation is when you cut your finger, or you get a burn, or you get an infection, or you get a fever. So even fever is an acute response when the immune system helps you fight and repair the problem. But the problem is when that fever becomes chronic, when something becomes chronic. And when you have a wound, let's say you hit your leg and the ankle gets swollen, which is an inflammatory response due to trauma that happened, and the healing aspect, and your body is telling you not to move your ankle because you need to heal from the damage. So acute inflammation has an important role in a body telling you that something needs to pay your attention, but your body is able to heal from it. So it's not chronic. But for most people that we help with, they're dealing with chronic inflammatory state where we have the autoimmune disease, cancer, cardiovascular, neurological diseases. We're going to talk a little bit about that in this class. And this is where your immune system is not functioning properly. So it's dysfunctional immune system. It's not functioning properly. So that's why, what does it work when you're trying to reverse your disease is you can see a client, Diana, a lot of people come to us with rheumatoid arthritis. She has seen 14 different doctors, and she also has seen a chiropractor, nutritionist, functional doctors, but she was bedridden from her arthritis. And that's why there's a lot of things like supplements she was taking that we helped her identify that was keeping her inflammation levels up, as well as some foods that she was eating. She was following anti-inflammatory protocol, AP protocol that you can find online, but it was not working enough for her to be able to reverse her aggressive arthritis disease. But we do actually check in with our clients every day. You can see that they submit to us daily journal report, and you respond back with a feedback and adjustments to your recovery. So if you're not seeing results in your autoimmune disease within 30 days, it may be something that you're doing wrong and not realizing it. Like I said, we do provide daily communication with our clients to be able to help them recover. But when you think about it, what kind of rheumatologist doctor is going to be doing that? They're not going to spend every day, including weekends, with a patient, helping them heal. But not only that, they don't have experience reversing autoimmune disease with nutrition. So that's why a program, it cannot be done without a supervision, because we supervise you and guide you through the recovery and adjust it. So one thing I wanted to talk about is going back to inflammation. Arthritis is causing this joint degeneration, but you're not just seeing it in arthritis, you've seen it with other autoimmune diseases. The same thing is happening when you have inflammation in the colon, or you have colitis or Crohn's disease, inflammation in the gut, and different IBS type of symptoms. So those of you who are dealing with IBS type of symptoms, whether it's gastritis, or you have stomach pain, or you're getting diarrhea or bloody stools, that means your gut is irritable. And what is irritating that gut? It could be the things that you're eating. So the same thing you see in cardiovascular disease, where someone is eating more pro-inflammatory foods that leads to having heart disease problems. And you have to realize this is one takeaway you can remember to write and tag us. That's 3 people in the United States every minute are having a heart attack. So every minute there's 3 people in the United States are having a heart attack. So that just shows you how doctors are not, and medical community are not doing a good job helping people not only prevent this disease, but also reverse them. And you also get inflammation within the blood vessels, and that leads to the inflammation in the brain and causing something that's called the aging brain, dementia, Alzheimer's. So neurodegenerative diseases, we are looking at the brain being inflamed over decades. And you can take a screenshot of the slide if you want to post it, as well as your takeaway as another option. Another thing I want to talk about is telomeres. These are the ends, they're located at the ends of your DNA. And with inflammation, you get a shortening of telomeres, and more inflammation you have, the more oxidative stress you get, and shorter is the lifespan. So you can see that basically it accelerates aging. So when I talk about aging, I'm not just talking about aging of your skin, but I'm also talking about the aging of the organs. But you can reverse the aging of your organs. And my sister and I, we started talking about it in our early 20s, but nobody believed it. There were some people who used to laugh about it because we were young. Of course, in the 20s, you're not going to look like you're aging. But now in the mid-30s, people are paying attention because it is being spread by other doctors as well. So optimizing your nutrition for rapid reversal inflammation is important because we are repairing the inflammation in the body, and it has to be done correctly for the disease to go away. And most people are not able to heal, like I said earlier, because they keep re-injuring themselves with inflammatory foods and they're not realizing that they are. So let me answer one of the questions that Kristen asked. She said she's dairy-free, egg and gluten and sugar, processed foods, peanut butter-free over 2 weeks because her holistic doctor told her to do so. And her labs came back high levels for immunoglobulins. So, and she also has psoriasis, dizziness, and brain fog. So again, when it comes to reversing autoimmune diseases, it's not just what you're avoiding, but what is it you're still eating that is not allowing you to be able to create healthy immune system and healthy cells in the body. So there could be things that you're eating, even though you're avoiding a lot of inflammatory foods, like a lot of our clients who are not eating any dairy or gluten or sugar, but they still have an autoimmune disease. So you want to make sure what is that you're still eating that's keeping the inflammation levels high, but as well as you getting other symptoms like dizziness. So that can come from blood pressure issues. So thyroid issues, we've seen that clients have that. So you want to make sure that you addressing the symptoms. And Florence asked, I know your advice is on nutrition. What is included in that plan? So like I said, we're going to go into the detail about that. We do help people create a recovery plan based on their disease and symptoms, where we tell you exactly what you have to do to repair your organs. But it really depends on what kind of disease you have and what you have to do and eat for it. So that's why it is personalized plan, but we do focus on real food you can find in your grocery store. There's no protein powders or supplements. So we do design it based on your organ function and your diagnosis and what is that you're currently doing and eating that will help you adjust in your current recovery plan. So if you don't get an autoimmune disease under control, it does increase the risk for cancer goes up. So over 40% of patients with colitis develop colorectal cancer after 25 years of having it. And the same thing with rheumatoid arthritis, over 10 years of having it increases the risk of lymphoma by 71-fold higher. So that's what we have been saying along, that again, if you have changed your diet, but not seeing results in a matter of 30 to 40 days, it's a good idea that you still could be doing things that are keeping your inflammation levels high. If you're not able to identify what it is, that's when it's time to get help with it. And we really want people in our program who will follow and participate regardless of what is that we ask you to do. But you have to understand that chronic diseases and cancer are preventable. And in most cases, require major lifestyle change. So that's why even if you just remove some of the inflammatory foods, it's not major enough for most people. And genetics accounts for only 3% of diseases. That could be your one takeaway from today. So again, people always want to do all sort of complicated genetic testing, and doctors talk about fancy terms like kill your mitochondria, and they tell you they can help you, but when you go to see do they have results that you're after, they don't have any results. So that's why the question is, who do you trust for advice is people who have the results that you're after. So it did take us 11 years to make it simple without any testing or supplements, but you can see that diet is 35% increases. If your diet is not correct, it increases your chance of disease, but this is the highest among tobacco, infections, obesity, environmental pollution, and genetics. So that means that focus on 97% of what you can control, and that's why at least 80% of diseases are reversible with nutrition. So epigenetics, that's what it means. It means your nutrition, lifestyle, and environment, and how these genes actually express. And people think that heart disease and diabetes run in the family, and it's not the gene that gets passed on, but it's an environmental trigger that's triggering your genes for disease. And so that's what I really wanted to address it, is if you're not repairing your inflammation, there could be things that you're eating that are inflammatory, like we talked about earlier in this class, where a client was eating honey and protein powders thinking that it's healthy for her, but it's triggering inflammation in the body. So the same thing, aggressive illness does not respond to autoimmune protocols, because there's so many things on those protocols that are inflammatory, or they might not be healing for you. So again, every food that you should be eating should be creating healthy immune system and function in the body. And like I said, focus on 97% of what you can control and take strong action for change. So there are 3 things you must focus on to repair the immune system. Number 1, you stop the triggering inflammation and re-injuring your body and your cells in the body. And also number 2 is, this is where a lot of people fall into they're doing it wrong, because they're not eating the right foods in the right amounts to be able to repair the immune system. Because even how you prepare your food can make a difference between full disease reversal and remission. So many people can go into remission many different ways. Even by taking medication, you can go into remission. But to no longer test positive for an autoimmune disease, you also want to make sure that you're reversing your autoimmune markers. And then the third step is you want to learn how to maintain your results. So a lot of questions people ask us, do I have to eat a certain way forever? You don't have to eat a certain forever, but how sensitive your body is to getting sick depends how many healthy cells you have in the body. So what does this mean? Some person who is relatively healthy, they can drink a glass of wine or eat some of the processed foods, and it's not going to do anything to them. The same thing with somebody who had lung cancer. If they had a lung cancer and they healed from that lung cancer, but every time they smoke, they are dying with every puff. The same thing when it comes to autoimmune diseases. You want to learn how to not just repair the inflammation, but how to maintain your health long term. But once you're healthy enough, your body is able to tolerate some of the inflammatory foods. And that's one of the things that we also address when we work together. How do you go after 6 weeks, after 8 weeks, after you're symptom-free? How do you make sure you remain disease-free for life? That's what we address as well. So how do you succeed at disease reversal? We're going to address questions as well. And those of you who are tuning in late, let us know what questions you have for you. So if you're getting instructions from your functional doctor, then you have to be specific and easy to follow and clear. So if you're just getting a list of foods you should be eating, list of foods you should be avoiding, that's not a good plan, because the plan has to be personalized to your specific disease, where you know exactly what you have to eat, breakfast, lunch, and dinner, and how much, and how to prepare your food. And then the second step is, based on the progress that you're making and how your body is responding, you need to be able to problem solve. Are you getting healed? Is your symptom a disease crisis? Is that a flare-up if you're getting a symptom? Or is it a healing? Or is it part of your healing process? So that's why you need to address the issues and challenges that arise along every step of recovery. So you do need to have somebody assess your progress every day and course correct your recovery based on how your body is responding. So people can get into remission by following some kind of protocol, like I said, anti-inflammatory protocol. But if you still test positive for autoimmune disease, you still have to be dependent on medications, and means that you haven't yet reversed it. Does this make sense? So we have been able to help people not just reverse the symptoms, but also autoimmune markers. How to reverse your autoimmune markers to get no sign of disease. So you get no sign of disease. So that's the difference between remission versus full reversal of the disease. Is remission is where you can be stable, you're feeling fine, but you're still experiencing flare-ups. Like many of our clients, they were still having symptoms following anti-inflammatory diets like removing sugars, but they were still getting flare-ups and still test positive for autoimmune disease. So you know that your disease is gone is when you eat something inflammatory. Let's say you drink alcohol and you don't get any symptoms, and your lab markers have not gone up with that as well. So you do have to reverse your autoimmune markers to not be able to get diagnosed with an autoimmune disease. So that's one way you can assess, have you healed from a disease? If you eat something inflammatory, your symptoms come back when they have already been gone, or you're still experiencing flare-ups every now and then, which means there's still chronic inflammation in the body that's getting triggered. So side effects of medications, they do suppress the whole immune system. I don't know how many of you have known that, but a lot of doctors, they do give medications to people with autoimmune disease because they don't have another way of helping you. And some people are so sick that if they don't take medicine, they will die from an autoimmune disease. They're going to have so much inflammation, but there are side effects with medications. They suppress the whole immune system, which means including part of your immune system that helps you fight infections. So you could get an infection, you won't be able to recover from an infection. You can get a cough or pneumonia. That's because the whole immune system is suppressed. Of course, it's going to give side effects of fatty liver, organ damage, cancer. People can even get liver damage and kidney damage by being on these medications long term. So that's why with nutrition, there are no side effects. But if you are getting side effects with nutrition, if you are losing too much weight, or if you're becoming deficient, or if you're getting more inflammation, if your inflammation going up, like Kristen has said, that means that there's certain things that you're still eating that are keeping that inflammation levels up. And again, none of our clients are exercising in our program. You don't have to exercise to reverse your disease. The same thing, you don't have to take turmeric to reverse your disease, but definitely there are things that you're still eating that are keeping the inflammation levels high and not repairing the immune system. So that's why I wanted to share with you, if you are getting inflammation markers, if you are getting increase in inflammation, when you have changed your diet, it means that you're missing certain nutrients to be able to create healthy cells in the body. Like I said earlier, when it comes to reversing diseases, it's not just what you're avoiding, but what's missing from your diet to be able to create healthy cells. So that's why this is a client who is a PhD scientist. She was doing the program for lupus disease, but she was able to go dancing without having pain. And she wasn't able to do that before, was able to lower one of her medications. This is just in 40 days. And her mom was following everything we were teaching, and her mom fatty liver has improved because the medication her mom was on for scleroderma, autoimmune disease, was damaging her liver. So that's why you do need to be seeing this type of progress, regardless how healthy you are eating. There is most likely something missing in your diet. You're not doing the right way in the right amount to be able to create healthy immune system, which we do help you problem solve what that is based on your specific disease and symptoms. So functional doctors always tell you, get to the root cause, and they tell you to remove infections from your body, heavy metals, or viruses like Epstein-Barr virus. But even if you remove those infections, and a lot of people have Epstein-Barr virus in their body, a lot of people are infected with this virus, but they don't have an autoimmune disease. So what you need to focus on is you want to focus on the whole system healing rather than addressing body parts. So instead of focusing on just one body part, heal your gut, you have hair loss, take the supplement for this hair loss, you need to heal the whole body. So that's why they do try to focus on the root cause, but the same thing, they're just managing and addressing the symptom rather than healing the whole body. And when the immune system functions optimally, it's actually going to help you fight these infections. The same thing with long haul COVID. People who were infected with COVID, other clients that lived with the family members who had COVID, they didn't get COVID. And again, it helps your body get back to its optimal function. When your immune system is functioning that way, it also means that the food you're eating is helping you create every cell, healthy cell in the body, not just the immune system, but your hormones, your skin cells, your hair cells. So everything should be getting better when you're recovering. One example is Hashimoto's and Graves' disease. These are autoimmune diseases, but they're not treated as an autoimmune disease. The doctor replaces the thyroid hormone with thyroid medicine because your body is no longer able to produce this hormone in case of Hashimoto's disease because the immune system is destroying the Hashimoto's. So what's happening? The immune system is destroying the Hashimoto's disease. So you're no longer able to produce thyroid hormone. And the doctor just give you the thyroid hormone because you're not producing enough. But it doesn't stop the autoimmune disease from progressing. And that's the reason people develop arthritis, colitis, because of untreated inflammation. And the immune system, once it destroys the thyroid, it goes and picks a different organ or body part. So that's the reason just by taking thyroid medication does not reverse autoimmune disease. You want to be reversing your autoimmune disease where your symptoms are gone and your labs go back to normal without medication. So you could be doing a lot of right things, but where you are not doing enough to see reversal of your disease, that's a question for you. What are you still doing that's causing harm to your body without realizing it? So that's what I wanted to address. Let me see what questions you have. Susan asked, doctor prescribed for you immunosuppressants in the Duke hospitals that the chest shingles and optic nerve inflammation because my immune system was suppressed for lupus. I have high ANA. I'm not sure what the question is. Yes, so if you do have high ANA marker, ANA is autoimmune marker, but not everybody with an autoimmune disease will have positive antibodies. So some people who have an autoimmune disease, they might have inflammation marker, they might have other labs that are out of range, and some people have symptoms for years before they become diagnosed with an autoimmune disease. So that's why not everyone with an autoimmune disease will have high ANA, but high ANA means you have more autoimmune antibodies that are floating around in your tissues and destroying your cells. So that's why they do give you immunosuppressants, but they're giving you side effects because they suppress your entire immune system, including the part of your immune system that helps you fight infections. But what we do is we teach you how to stop triggering the inflammatory part of your immune system, but as well as how to use food to get your immune system get back to normal function, but as well as what you have to continue doing after you're healed, or how do you continue seeing positive results in your health after 6 to 8 weeks of us working together. But we do help people address individual issues, providing daily unlimited help. Let me know other questions you have for me. And like I said, Christine asked, how dangerous is having really high levels of immunoglobulins? It was off the charts by 10 points, and the lab test was taken 7 days after cutting out the inflammatory foods. So again, if you have high levels of inflammatory immune system antibodies, so that just means that you have increase in inflammation. Even though you have cut down other inflammatory foods, but maybe your body, that was not the most inflammatory trigger for you. The foods that you cut out may have not been the most inflammatory trigger for you, but also you may have replaced it with another food that's actually triggering more inflammation in your body. So that's what it means. So the food that you have replaced it may be triggering more inflammation in the body than the foods that you have removed. Does this make sense? And Elizabeth asking, what is one if your complement levels are low? My daughter has lupus nephritis. That's because your complement is part of your immune system. And if they're low, it means your immune system is using it up for chronic inflammation. So when you have an autoimmune disease, your complement levels will go down because the inflammatory part of your immune system is using it. So that's not a good sign. With an autoimmune disease, the same thing, people can have elevated white blood count, or they can have low complement levels. That means that your immune system is working hard in the chronic inflammatory state. That's what it means. It means that your immune system is using up the complements. That's why they go down to in the lupus disease. And I do know, I think, Elizabeth, we've talked to you a few years ago, but unfortunately your daughter wasn't very open to changing her nutrition with her lupus nephritis, but definitely it's going to help her benefit to get her kidneys to function better and get her immune system under control so it stops attacking her kidneys. But you did mention your daughter has tried different diets, but she wasn't able to recover. Lori asked, what micronutrients are usually low? So that's another thing. Yes, so Elizabeth said her daughter is not agreeable. So that's why it's hard sometimes with children when it's hard to help children with autoimmune disease if you not try to do it as a whole family. So we have worked with a 7-year-old child. That's what I want to show with you. Let me just stop this for a second, and I'm going to take other questions. But I wanted to share with you is this is a Facebook page, and every day make sure that you follow our page, but we do educate you on it. Under every post we do provide education, but you can also see how many people we have helped with autoimmune disease. If you just scroll through, these are the emails that clients have shared us, and we do have a private client group with other clients in the program, so you can just see how many people we have helped become symptom free and set them on the right recovery path. And so we did have a child that we have worked, going back to your question, we did have a child that we have worked who had arthritis. She was 7 years old. She was able to follow it really well. So that's why we do have experience helping children, but they do have to be a little bit open to it. And Lori asked, what micronutrients are usually low? Usually people are low in there's a lot of nutrients, but even if you're low in micronutrient, it might not show up in the blood work. You have to be chronically low in it for it to show on the blood work. But there's some of them like magnesium, a lot of vitamins people are low in, but realize that when you're taking vitamins, taking isolated vitamin can give people side effect. And there's published studies, we have actually published it on a Facebook page, that people can get side effects by taking isolated vitamins. For example, taking folic acid can cause side effects in their health, negative side effects. Taking it long-term, taking a vitamin A long-term can cause side effects. So you want to be getting all your micronutrients from food. But if you're not getting enough, you also want to oversupply your body with those nutrients from food. Makes sense? But it often will not show up in the blood work. People are often low in magnesium, all of these micronutrients like calcium, potassium. Could autoimmune disease be caused by leaky gut? Should I treat leaky gut first and reset the gut? No, because a lot of people treat leaky gut, but a lot of things that people eat cause inflammation in the gut lining. So even if you address your leaky gut, let's say you take a supplement, a lot of people take L-glutamine, they have inflammation in the gut lining, but they still have an autoimmune disease because of the things that you're eating that are injuring the gut lining. So it's not just taking the supplement that they usually do to try to heal your leaky gut, because you want to make sure the food that you're eating is also repairing the gut lining and it's not triggering it. Does this make sense? So all diseases, because it's what people are eating, it's because what people are eating that's triggering inflammation in the gut. So it's what people are eating that keep injuring their gut. So, and activating the immune system in the wrong way. So if you have positive antibodies, there's something that you're still eating that's causing inflammation in your body, including your gut. Makes sense? So just taking the supplement, you want to make sure you also stop doing what's causing the injury. Makes sense? My RA doctor is putting me on Arava on Monday. I'm super scared. My natural doctor said I have leaky gut. That's what caused RA. I have tons of supplements. So Kate, yes, and we do, like I said, we do help people reverse arthritis. We have clients who became symptom-free, and we do offer a payment plan and a program for US clients. So those of you who are looking to get a help, like I said, our last opening of the year is in October, and we do have about 5 spots available for October. You do have to have a schedule a call with us, email us to reserve your spot if you already had a call with us, or follow up with us so you can get started on your recovery. We do close the enrollment September 30th, and we do offer a payment plan. Actually, we started offering this year. Fortunately, someone helped us set it up. So we were able to connect with the financing company, and they were able to set up a payment plan for you to be able to help you. So does your program do any fasting? We do not do any fasting. So that's when it comes to using food, you want to use, because your cells are made out of the food that you're eating. So we do want to use food to repair the inflammation, but as well as create normal cells in the body, a normal immune system, normal hormones, normal skin cells, normal gut cells. That's what we're using. So we don't do fasting, because when you fast, you're not eating anything, and your body cannot heal without the nutrients, without the food. Makes sense? And that's why some people, I wanted to address, some people can feel better when they're not eating because they're not triggering the inflammation through food. But as soon as they start eating, they trigger the inflammation back. That's why it's a good idea to learn not just how to repair the inflammation, but also how to maintain your health long-term so you don't trigger the disease back. Does this make sense? Why we don't recommend fasting? Because it's a temporary solution. You're not eating anything, so you're not going to be triggering inflammation, which allows your immune system to come down. But as soon as you start eating, it comes back. Makes sense? Can you help with misdiagnosed autoimmune disease? Yes, we have helped people with misdiagnosed, and I heard fasting can heal. It's like aphalalgy or whatever it's called. So fasting, it really depends. What do you mean by fasting? Are you drinking juice? Are you water fasting? So it can calm the immune system, but you still need to learn how to use food to create healthy cells. That's what I'm talking about. But all the people we have worked with that you can see on a Facebook page, we were not doing any fasting with them. So why would you? And another thing I wanted to address, people who have autoimmune disease, they're already chronically malnourished. And when you fasting, your body is using whatever nutrients it has to be able to perform basic function. So people who have an autoimmune disease, they're already chronically malnourished. You do need the nutrients to heal the body. Makes sense? Lori is asking what amount of food protein is usually recommended daily. The reality is a body is able to run on 20 grams of protein a day. And of course, most people, protein, it's not a food group. It is something that was discovered first. It was discovered before carbohydrate. It was discovered before fat, and they thought it was the most important molecule. But the reality, it is not the most important molecule. And most people eating too much protein that they're eating in their body that's causing their diseases. Makes sense? So usually people, a body just needs 20 grams of protein to survive. So that's why when you give your body all the nutrients that it needs, you get plenty of protein, carbohydrate, and fat as well. So that's why I feel like I react to every food I consume. I have microscopic colitis. How will I help recognizable food is what causes inflammation? So we did talk about that in this presentation earlier. You can watch the replay. We will upload the replay, but we did talk about it in this slide somewhere here, because not every food people eat will give a symptom. So for example, a lot of people tell you to eat honey or take protein powder because it doesn't give you symptom, but it doesn't mean that it's anti-inflammatory. Some of the foods might not be giving you symptom, but they do have inflammatory component to it. And how do we help people with colitis? That's because we do have experience reversing this type of disease. So we guide you through a proven process. And if you don't have any symptoms, you just go through a process and follow it. And then we either adjust your recovery plan. When your gut gets healthier, you're going to be able to eat more things that your body needs to heal and repair the inflammation. Some people have inflamed gut. They get constipated, they get diarrhea. So all of it has to do is how healthy your gut is functioning when you are getting those symptoms. So if you feel like you react to something, we do have to understand what kind of symptoms you're experiencing and what it means to you. So the meal plan based on plans, what kind of foods for anti-inflammatory. So we do help people create a plan based on their disease and exactly what they have to eat. So not every person who works with us is going to be able to eat the same thing. So for example, like I said, someone who has diarrhea, they can't eat, or someone who has gastritis, they can't eat the same foods that the person who doesn't have the gastritis. But we do focus on real food that you need to use to repair the body. Okay. And feel free to, those of you who are just joined in, you're welcome to unmute yourself and ask the question. And I do see somebody else joined in, and we'll have the replay available for you at the end. So like I said, we do have the last opening of the year is in October. We are offering $500 discount for people who do end up getting a help. And there's 5 spots available. And if you did learn from this class, you found it to be beneficial, tag us in a Facebook group and let us know one of the takeaways that you learned. So for other questions, you can email us the questions if you have any follow-up questions with that. But like I said, we do help people problem solve what's causing their symptoms to stay, what they're not doing right, but you do have to go through a process for reversing colitis. That's what Natya asked, because she's not able to recognize what food is causing inflammation. That's because we do have experience reversing diseases. We will be able to recognize it for you. And we do not run any tests. We do, like I said, we do understand which foods can be inflammatory and triggering more colitis symptoms, which one not. But it doesn't matter what kind of colitis disease, whether it's ulcerative colitis, whether it's microscopic colitis, like we talked about in this class. It means that the gut is irritable and it's inflammatory, but this inflammation can be in different area of your colon, the small intestine, the large intestine. It really doesn't matter what kind of colitis you have. It's still inflammatory disease, just like all of these diseases listed on the slide, but this is not limiting to these diseases. Type 2 diabetes is inflammatory, cancer is inflammatory. As you know, people who have autoimmune disease, it increases their risk for cancer. People with colitis get an increased risk for cancer as well, like we talked about in this slide. We talked about difference between acute versus chronic inflammation. We explained what inflammation was. Another presentation that we did a month ago, we discussed epigenetics and how you can untrigger your genes for disease. So that's what we talked about. And we also addressed weight changes. Why do people gain or lose weight and what it has to do with inflammation? I think one of these slides, we did talk about, just not sure where that slide is. So for any other follow-up questions, feel free to send us an email if you have any follow-up questions about what we talked about. And then we do have a Facebook group where we do have the replay available. You can go and join the group here. So we do have a client group, and this is a Facebook group where we have the replays available of all the classes. If you want to get additional information, you can join this group. And then a client group. So a client group is, this is a client group, and this is with clients who are working with us right now in the program. We also have different education that we provide. We do have weekly classes with clients that we teach. This is where all our clients share their celebrations, and that's where all of these screenshots come from. But like I said, you're welcome to join a free group if you would like to have additional education, and you can ask more questions there. We do have a free Facebook group. Let me see if there's another. Thank you so much for your time. I will be in touch. Kate has said, you're welcome, Kate. I'm glad that you joined. And like I said, we do offer a payment plan. Those of you who are struggling to finance it, we didn't offer it before. All the people who worked with us, they did pay for the program upfront, but we do offer a payment plan for the US clients, and we have different variations of the program as well. So when it comes to autoimmune disease, you don't have to understand how everything works. You just have to get results. You don't have to understand, okay, I just don't get it, right? How can food heal me? That's one objection we get is, how can food heal me? I'm eating so healthy. But if you're not getting results in 30 days, there's a good thing that you're eating foods that are inflammatory, they keep triggering your inflammation, or you're not doing enough of the right things. So Susan said, thank you for the Zoom class. I really appreciate it, Kate and Susan. Please tag us in a profile and let us know what you're taking away from. Feel free to ask us a question. I'm happy to offer everyone who's came to this class a $500 discount, a $500 discount in the program. So hi, Mariella, good to see you. I saw Mariella just joined the class. Let me know what your questions you have for me. And I believe that you need help with them, with your gastritis. I'm not sure if you still need help with that, but feel free to reach out to us for help. And otherwise, we are going to finish up. Florence Ho, the same thing goes for you. You came for this class. With everyone who came to this class, we will offer you a $500 discount. But as well as if you do need extra time in the program, most people who work with us don't need it. They don't need extra time in a program, but we will offer extra 2 weeks if you need to, okay? For additional support, education, and guidance, so that way you have all the tools to be able to not only be on the right path of reversing your autoimmune disease, but also get educated how to become disease-free. So there's a lot of help that you will be getting, and as long as you participate and ask questions, okay? That's what we want. We want people participating, asking questions, reaching out for help. That's what it really takes to get reverse your disease. And I know those of you who are on this class, you're very serious about getting yourself healthy and becoming symptom-free. And I know you are doing everything you can to recover. But like I said, if you're not getting the results that you're wanting in your health, that's what we are offering to help you. Let me see. Thank you. I still need help, but the problem is the money. The finance option would be great. That's what Mariella said. Yes, Mariella, I'm going to see if I can. Let me take a note to make sure that I follow up with you. And I'm going to follow up with you and send you the payment option, okay, that you can look into, because sometimes I do forget to follow up with Mariella and Kate and everyone else who is who's scheduled to call with us. We will discuss the payment option with you on the call, okay? Follow up with the payment plan. Okay, so it's great speaking to everyone. I already had a call with you. Kate already had a call with us. Yes, but we'll still follow up and have a chat to get an update on your situation and get started. I'm very interested and want to have fun till end of September or beginning of October. That's okay. Kate, Christine, did we talk with you? Snyder, your name sounds familiar. I'm not sure. There's a lot of people we talked to, but I really appreciate you all being on the class. And not yet. Christine Snyder. Okay. I think we do have a call coming up this Tuesday. Yes, that's why I do remember names. Okay. Thanks everyone for coming.